Thank you for asking me to come and speak today. Um, One of the big questions that people ask, and that you've asked me, um, is my hospital a good fit? And there's never really a clear black and white answer. It's usually a shade of gray, and it depends a lot on a variety of factors. No one factor makes a hospital a good choice, and no one factor makes it a bad fit for the program. And it depends a lot on what um, attributes a hospital does have and those that they don't have. That how those really add up to see whether or not a hospital is a good fit. By way of example, one of the gatekeeping attributes is the bylaws. When it comes to education, learners, proctoring, supervision, what do the bylaws have in them? How do they approach that? Is the language and, if you will, the rules of the road in those documents, does it allow for, is it permissive to the program? In other words, are the rules of the road such that the program could drive down the highway? And if the answer is yes, that's a pretty big factor. And within the bylaws, usually it's under the part that deals with education or the part that deals with proctoring or the part that deals with credentialing and such. The next one is really more about people, right? How are the people on the site? Is the program have the right sorts of people with the right mindset for a program to be successful? By way of example, does the anesthesia department want to do this? Are there people in the department of sufficient number and of sufficient willingness to want to teach, mentor, provide the supervision, and document it? And again, that sometimes is a gray answer. Maybe it's not everybody, but maybe it's somebody or some group of people. And whether or not you have that at all or not, or there's a certain extent you do have it, will depend, will set sort of the stage about whether or not you can do a program. Then you get into the surgeons. If the surgeons do not want to have a program like this, it's not going to fly. It just won't. At the end of the day, these patients that are going to be taken care of by people in the program, these patients came to their surgeon originally to have surgery or told they needed surgery. And at the end of the day, it's a surgeon's patients who are going to provide the nidus for clinical opportunities that ARRP candidates will have. So the surgeons have to be on board for sure. We shouldn't forget about the OR nurses. I think most people could appreciate that not all OR nurses are the same. Some of them see a resident taking care of a patient, and that is unsettling, it's disquieting, and it could be disruptive to how they're getting their job done as OR nurses. So it's very much the same here. And it's a little bit more complicated here because these are people that already completed a residency. Many of them either are board certified or are on the road to become board certified. They're not, from a career perspective, early career folks. So they don't look oftentimes like a resident. But in terms of how they are being treated and supervised and evaluated, they are sort of, in some respects, looked at like residents. So your OR staff, OR techs, OR nurses, circulators, scrub, whoever, they really have to be on board and they have to be comfortable with this sort of program. If they're not, it's just not going to work, period. If you now step over to governance and take a look at what governance, attributes, are important, this is beyond the bylaws, of course. This is something that is beyond the bylaws, but it might fall under, governance, is sort of an MSO. What does the medical staff office look like, feel like? Are they enthusiastic about the program? Do they understand the program? Do they understand the concept of iterative evaluations and iterative expansion of, of, of privileges. Are they willing to put these candidates on their agenda quarter after quarter, month after month, so that the credentialing committee could talk about them and decide whether uh, their uh, their privileges could be advanced? And if an MSO doesn't want to really do a program like this, it just won't be successful. And that's because when they follow the rules of the road as per the bylaws, they're just not going to be, they're going to arrive at conclusions that it's just not going to be something that they feel comfortable with, and that will prevent a program from being overwhelmingly successful. Now, as we've spoken about before, these programs, from a governance point of view, they could fall under the Office of Academic Affairs and be considered sort of a non-ACGME fellowship, or they could fall under the MSO and be sort of a program that rests on proctoring and supervision. And those two approaches are important to remember, whether it's MSO or whether it's Office of Academic Affairs, because if it falls under, the Office of Academic Affairs, then, they have to be on board for this. And, many executives that function in or lead the Office of Academic Affairs, they have a lot on their plate. They have tons of ACGME programs. They may have programs for, nursing, and they might have programs for PAs. They might have programs for medical students. Who knows? But Office of Academic Affairs are very busy. So it's important that if the program is going to be under the Office of Academic Affairs, that the executive leading that office is an enthusiastic supporter of it and wants to be involved. They're a key stakeholder, no less than, more than the OR nurses or the surgeons. And again, you could take what I just said and apply that to the MSO. They have to be supporters of this, and enthusiastic supporters of this, and be willing to work with the program on this. In summary, the big considerations, if you're a hospital, whether or not you're a good fit, depends upon governance related matters such as your bylaws, the view and impressions and support you may get or may not get from the Office of Academic Affairs and or the medical staff office. And it depends upon the views and support and desire and willingness of professionals such as surgeons, nursing, ancillary staff, and probably the most important here, the anesthesiology team that likes to teach and supervise and complete evaluations. And that, in short, is how ARRP examines a given facility to see if they're a good fit.